Up and welcome back to Your Health Light. This is Dr. Williams-Singh, your acupuncture physician. Today we're going to be doing part 3 of the small intestine, and you might be wondering, why is she spending so much time on the small intestine? I did cover the small intestine, and I covered it with the explanation based on Western medical modality. Today we're going to do some comparison, and also I'm hoping that this is something new, a concept that you'll find very, very interesting, and this is based on scientific study. As mentioned earlier, the small intestine is used for absorption of nutrients, and I well explained that. If you need to have more depth of that, please look at the previous videos regarding the small intestines, because today's highlight is the following: the consequences of not keeping good organ fitness. That's one. Telomeres, that might be a new concept about that you don't know. It has to deal with genetics in your DNA. And number 3, connecting and comparing and contrasting the language used in TCM versus today's modern medical modality. That would be the Western way of explanation. First and foremost, I'm going to be very clear and very specific when I'm reading the scientific studies and when I'm also reading the book that comes from the foundation of Chinese medicine. Have you ever considered the following? In most cases, we look at ourselves as aging people, and we're considering all the things that could occur as we age, as we move along in life. One of the most profound ways of looking at food therapy and herbal therapy is the following: your congenital essence. And what is that? Your congenital essence is what you as an individual has in your DNA. If there's something that is damaged or something that is potentially cropping up as a problem, your congenital essence can be changed. Your metabolic conditions can be changed and solutions can come about. In the Western explanation, when one age, we're expecting anything besides improvement. It's described to us as basically you're going down, you're degenerating, things are happening, but not necessarily so. Here's what I'm going to read. The function of the small intestines, and again, this is coming straight out of my book. The small intestine receives food and drink after digestion by the stomach. This is transforms further by separating clean from a dirty part. Keep that in mind. The function of small intestines are: it controls receiving and transforming. It separates fluids. In the Western explanation, and guys, what I'm trying to convey to you is this. This is based off of information that's been documented for over thousands of years. And quite frankly, this concept is probably more profound in a lot of healing modalities when it comes to alternative medicine. But I'm just reading from this book. Next up, the small intestines receive food and drink from the stomach. It carries out it carries out its job of separating clean from dirty. That is very important. The clean part is then transported to all parts of the body to nourish the tissues. The dirty part is transmitted to the large intestine for excretion as stool and to the bladder for excretion as urine. Guys, what is so different about this explanation versus the explanation from the Western modality? It's just a different choice words, but it's conveying the same thing. Let's move on to another thing, which is this oxidative stress. Oxidative stress can be minimized by having regular exercise, whatever fits into your plan, whatever you can do to exert yourself. That is another source of relieving oxidative stress. Now let's move to telomeres. It's spelled Telomere. This is from the National Institution of Health, based off of scientific evidence, and this is not the only place you could find the scientific evidence. There are other places that has performed these type of tests in order to convey what I'm about to say. I'm going to remove you from going through the medical jargon and just say this in very plain words. Telomeres, they're a protein structure, and it's actually sitting at the end of each of your chromosomes. It is very specific to your DNA, and it actually revolves around your genetics and aging. Normally, as one is aging progressively, your 20s, your 30s, your 40s, the telomere shrinks normally. However, that does not have to be. Think of the telomeres like this. It's like having the end of a paper and only the end of the paper shriveling up as one ages. That is a normal progression. However, let's look at this a little bit further. Scientific evidence states that the telomeres length is relatable to one's health in terms of aging. And when you think of aging, I know you're looking at it as a cosmetic point of view, like how you look, how you appear. We're speaking about organs as well, guys, because that is your everything. In addition, it's a protector for your genome and protects your genome from degeneration. The reason why I'm spending a lot of time on the small intestine, I'm sure you figured it out by now, because there is a multitude of actions that takes place in the small intestines. I'm going to give you the consequences and the risk of not having organ fitness, because certainly there are other organs that you'll be hearing about, but I'm spending a lot of time with this because of what I just said about the telomeres and the scientific study. The consequences of not taking care of or the fitness of your small intestines would be the following: bleeding, inflammation, infection, and obstruction. Those are just a few highlighted, most profound consequences. On the brighter notes, this can all be changed because of food therapy and herbal therapy. And also, before I forget, you could use fasting in order to attract the best potential for your telomeres. Until the next video, here at your health light, Dr. Williams-Singh.